I want to bring in Aaron Ford. He's the Democratic Attorney General of Nevada to discuss a little bit more about how this bill is going to impact states like Nevada. Thanks for being with us, Attorney General Ford. We have over 100,000 Nevadans set to potentially lose health coverage if this bill is signed into law, according to a report from Democratic lawmakers. We already know your state has significant doctor shortages. What impact are you bracing for there in Nevada?
Well, thanks so much for having me on for this important conversation. And, those are some stirring words from our friend Hakeem Jeffries. Reminds me of how personal this issue is for me in particular. As we say in church, I'm talking about what I know, not what I heard. These cuts to Medicaid, for example, are something that I have a very real understanding of. I was a single father in college, raising my son, having to depend upon Medicaid, and then it was called food stamps, not SNAP. Yeah. But depending on food stamps and Medicaid in order to get by. So I have a very real knowledge and understanding of how important this lifeline is for so many folks. And I'm quite concerned that what's happening at the federal level is going to have that detrimental impact that we are hearing being recounted time and time and time again. This isn't just something about numbers, although we are talking about in real life 700,000 Nevadans who could be affected by this. Most seniors in nursing homes depend on Medicaid. Yeah. 2 out of 5 of our children in Nevada depend on Medicaid. And a vast majority, over 2/3 of people who are on Medicaid go to work every single day, but their income requires them to rely upon Medicaid for health care. So I'm very concerned about what's about to happen at the federal level and its detrimental impact on my friends, colleagues, and neighbors.
I just want to follow up on your personal story. Thank you for sharing about the fact that your own family was on food stamps at one point, took advantage of these SNAP benefits just to survive, right? I mean, for those who are saying, well, this bill isn't going to really hurt families, it's just getting rid of the people who are, trying to get those benefits fraudulently, what do you say to them?
Nonsense. To be sure, waste, abuse, and fraud are things that we have to address, but this bill doesn't do that specifically enough. What we're talking about is ripping away health care for 12 million Americans. We're talking about my neighbors here who some immediately will have health care ripped from them for over 100,000 Nevadans. We're talking about a budget hole here that, by the way, our state governor should know very well and should not be so silent on this issue. But we're talking about having to pay $3 billion over the next 7 years to cover the difference when the federal government ends its 90% Medicaid match. Or is he going to let another 132,000 Nevadans lose coverage? That's our current governor. And it's shameful that he's not speaking up and defending Nevadans, which frankly is the reason why I'm running for governor. And we're going to be making that official launch later on this month. And I encourage folks to visit my website, forwardfornevada.com. But,
getting that plug in.
We are indeed concerned about what's happening here, and we need leadership in our state.
Attorney General, what about the no taxes on tips or overtime pay? One would assume a lot of people in your state would stand to benefit from that part of this legislation.
But, speaking of personal stories, when I was in college working toward some degrees, I was working at Outback Steakhouse making $2.35 an hour, walking around with food on my hand here, living off of tips. So I have a very real understanding and appreciation of that as well. And so I'm proud of the leadership that Senator Rosen and Congressman Horstman have brought to this particular issue. As I understand it, though, these aren't permanent in the bill right now. There's a cap on the amount of monies that will be associated with this, and there's a time frame on it. So I would urge Congress to lift the cap and to make it permanent.
You're seeing it in purple red states. Today is the day. People are saying, whatever this Pyrrhic victory is for Trump and Johnson and all of that, this is the day they lose some of these seats in red states, right? I know Nevada is not a deep red state. We're going to talk about a crazy red state in a couple seconds. I want you to stick around for that. But it is a state that did vote for Trump, right? It gave Trump the electoral votes in the recent election. It has elected Republicans to statewide office as well. So it's a state that certainly has a red tinge to it. And yet, people in that state know these cuts will hurt them. And the following really demonstrates it, guys. I want you to watch this. It is shocking, and you're going to see how the GOP screwed itself in elections.
Meanwhile, Democratic governors in red states like Kentucky and Kansas have been warning of the consequences if Republican lawmakers in Congress do pass this massive budget bill, as they are expected to do a short time from now. Those leaders say it would take health care and food assistance away from Americans who need it most. The bill cuts Medicaid, as we've been telling you, by $930 billion. It also cuts another $285 billion in food assistance. The Congressional Budget Office estimates nearly 12 million Americans will become uninsured by the year 2034 if the bill becomes law, and 3 million more will not qualify for food stamps known as SNAP benefits. Joining us now is the Democratic governor of Kentucky, Andy Beshear. Governor, thanks for joining us this morning. As we've been discussing for the last several hours, it does look like Speaker Mike Johnson has the votes among Republicans to get this bill through, to get it on the desk of the President of the United States, who says he will sign it by the 4th of July. As you read through the details of this massive piece of legislation, what will be the impacts in your state?
Oh, it's going to be devastating. This is the day that Donald Trump and the Republican Party are telling the American people, especially in rural America, that they don't care about us. You look at what's going to happen in my state. 200,000 of my people are going to lose their health care coverage. 20,000 health care workers are going to lose their job. This is the Republican majority firing Americans that right now have a good job. And 35 rural hospitals may close, which is going to impact every single community they're in. What people don't know about rural hospitals is that they're typically the largest or the second largest employer in their communities. So you lose all those jobs, and every small business in rural America is going to be impacted by having fewer people, less dollars cycling through. And then when you think about worker productivity for America, it's going to take a nosedive, because now you got to drive 2 hours to go see a doctor, not just for your appointment, but for your kids and your parents. And when your parent or grandparent gets kicked off Medicaid because they did not check a box, you're going to have to bring them into your own home, take time off of work, and ultimately pay for their medical expenses out of pocket. This is just crazy. It's going to hit Democrats, Republicans, independents. It's going to hammer the U.S. economy. This is the worst bill I've seen in my lifetime.
So as you grapple with this, what seems to be inevitable, that this is coming your way and to states across the country, how do you plug those holes as the governor of Kentucky? If 35 rural hospitals are closing in your state, what do you do about that on the state level?
No state has the budget to fix what the federal government that Donald Trump and the Republicans are about to break. No state can make up for hundreds of billions of dollars of Medicaid payments flowing through our economy. If you just look at the economy at large, healthcare is one of the fastest growing segments out there. And this is the Republicans just taking a hatchet to it. We're going to see job losses across America. And listen, we're going to do our best. We're going to do our best to plug some holes where we can. But even when you look at food assistance, which, my faith teaches me that in a country that grows enough food for everybody, nobody should starve. I mean, the miracle of the fishes and the loaves is in every book of the gospel. But look at what they're doing. Seniors and children are going to go to bed and wake up hungry. That's just wrong. And just the administrative costs pushed on Kentucky is an extra $66 million. So you think about plugging other holes. On top of that, you have the president not approving public assistance after natural disasters. That may cost my state another $300 million. So what this federal government is doing is fiscally wrong. It's going to add, trillions of dollars to the federal debt, but it's also going to blow up every single state budget where we have to balance those budgets. And I don't buy for a minute that they have to cause all this pain just for a tax cut. In Kentucky, I've expanded Medicaid while at the same time lowering the income tax and the property tax rate multiple times.
Governor, as a governor of a red state, you're a Democrat, but you, by definition, have to work with Republicans. You always have. You continue to do that. How do you explain the vote taken by Republicans in Washington? right now in Capitol Hill, all of whom know exactly what you've just said, that it is going to cost their own constituents, the place where they live, the people who voted for them, their health care in some cases, or the hospital that they've counted on for all of their lives. Is it anything more than feeling the pressure from President Trump, who was up all night calling members, who was up all night posting to social media saying MAGA will not be happy with you, talking about his own movement if you vote against my bill? In other words, how do you explain the members of Congress, let's just take your state of Kentucky, voting against the interest of many of their constituents?
Well, it seems like they care more about being a good Republican than a good representative or senator. I mean, they're elected to represent the people of their districts. And for every Kentucky congressman or senator that's voting for this, it hammers their constituents. People are going to lose their jobs that voted for them and that voted for the president. I mean, people have lost their way if they think their number one job is to stick with their party instead of their people. You look at all the congressional delegation that voted for it in Kentucky, every single one has a rural or an urban hospital that's going to get hit. Every single one is going to run into someone that's going to lose their health care and not be able to get a cancer treatment. Every single one has people in their districts that will die if they do not have health care coverage. Listen, I remember when we expanded Medicaid, my dad was governor at the time, and I was in an elevator with him when a woman walked in, burst into tears, and said, I'd be dead without you, without that expansion. She could not get coverage because they considered cancer a pre-existing condition. But with the expansion of Medicaid and the ACA, she could. These are real lives at stake. These are real people. And this is a huge betrayal. People care more about their families than they do their political party. And so Democrats, Republicans, and independents in Kentucky are going to react and react incredibly negatively when their friends are losing their jobs at their hospital.
Governor, it's Ali Vitale in Washington. We were just talking with Ken Martin, the head of the DNC, about how this bill, in terms of the issues that it brings up, is a gift politically in some ways for Democrats to take back out on the campaign trail in 2026. But there are concerns from advocates about the message, this perennial concern that we've heard since 2024. You're someone who has been playing in the space of trying to find different ways of communicating with new constituencies. What do you see in this bill, and how do you think it could be best communicated by
Governor Beshear was elected, and I don't want to downplay Beshear's talents as a politician and whatnot. And I know there's like a family connection, like he's got a family legacy in that state. But in part, the reason he was originally elected was as a response to Trumpism, right? He was elected in 2018, I believe, in that wave, and he was elected as a response to far-right Trump policy, and people in that red state said, we do not like this. Even some of us who voted for Trump are going to vote for the Democrat here because these policies are ruinous. And so again, you can look at moments and say, this is the day X lost the election. So you can look at this policy and you can say in this particular case, the day the big beautiful bill passed, right, was the day countless Republicans lost their elections in red states and in purple states and elsewhere too.